So we are here at the annual meeting of the American Society of Hematology, and we have very interesting and novel discoveries here that are being reported at this meeting. In particular in the context of graft-versus-host disease, which is a major complication after allogenic hematopoietic stem cell transplantation, which is a curative treatment approach for acute leukemia. And graft-versus-host disease is a major complication. It is connected to a high mortality in patients, and in recent years there have been important developments targeting major kinases. In contrast to previous developments, these kinases are downstream of multiple cytokine and chemokine receptors, which allows a more effective modulation of the immune response. So these targets have been more successful in preclinical models and are currently tested in prospective clinical trials, which are ongoing right now. For the patients, this is an important development because for those patients, disease means intensive, terrible disease, and those patients suffer from, in particular, affection of the intestinal tract, the liver, and the skin. Currently, we perform immunosuppressive measures in order to control this disease, but the measures are insufficient right now to control this disease completely. There have been strategies to deplete alloreactive T cells, which was successful in the sense that you have less graft-versus-host disease, but at the same time the anti-tumor immune response was blocked, which caused then a relapse of the underlying disease, meaning the leukemia or the lymphoma came back, and therefore it is important to find medications that are, on the one hand, immunosuppressive to a certain degree, but still allow the patient to have a strong immune response against the leukemia cells, which in the end are the cells that need to be targeted in order to be therapeutically successful.